Welcome to the third video of my OET course. This video is going to be about the reading part. It's part of the OET course that I always wished to have when I was preparing for my OET exam. In this video, we'll talk about the layout, time management, strategies, how to stay focused. We'll practice some questions and I'll also share some tips with you. Let's look at the layout of reading subtest. It has three parts, part A, B, and C. Part A has 15 minutes. Part B and C for 45 minutes. Part A, you will have 20 questions that you have to complete in 15 minutes. And in Part B and C, altogether, you will have 22 questions that you will have to complete in 45 minutes. So altogether, 60 minutes for these 42 questions. In this part, remember, it's not about time, it's about focus. As I mentioned, it's more about focus. So assessment focus will be based on comprehension. It means how quickly you get things. Information extraction, how quickly you can extract the information from the text. Altogether, 42 questions. As I've mentioned, it has three parts. So in part A, you'll have 20 questions in 15 minutes in part B and part C. Now, we will look at each part one by one. I'll tell you everything you need to score high in reading subtest. If you think this video is helpful, please subscribe to my channel and give me a like. Thank you. Let's continue. In part A, you will have four texts. You can see there will be four boxes with four different texts. Let's look at the sample exam paper. As you can see, you will have text A, B, C, and D. So four paragraphs. You will have 15 minutes to answer 20 questions. Here, you will have different categories of questions. Questions 1 to 7, where you have to write the number of the paragraph where you can find this information. Questions 8 to 14, where you have to answer in form of word, phrase, or short sentence. Questions 15 to 20, where you have to fill in the blanks. You have to find the words in the passage. Here, in this part, you just have 15 minutes to answer 20 questions. Let me tell you a strategy that will help you to score high in this part. Now remember, if you can score above 18 in this part, it's really easy for you to score high in the reading subtest. So my strategy is divide your time into three parts. You have 15 minutes altogether for part A, so you have to divide it into three parts. 15 minutes into 1 minute, and then 13 minutes. What you're going to do with it. First 1 minute, quickly look at the headings and what is each text about. So the heading is about fractures, okay? Text A is talking about fractures, dislocation, sprain, okay? Text B is more about simple fracture of limbs. It's about management, assessment, and then again management of that side. So you have to read it in a zigzag manner. In 1 minute, you have to go through all the text. You don't have to read it word by word. Instead, you just have to read it quickly. Just move your eyes over the text. C is about drug therapy protocol. Okay, what kind of drug? Intramuscular, subcutaneous. Okay, and then D is about techniques. Okay, so now you know in 1 minute what is each paragraph about. In the next 1 minute, you have to find where the answers are. So here, procedures for delivering pain relief. Just now you have seen that. It's in text C. Procedures to follow when splinting a fractured limb. So just now you have seen that. Just write down which paragraph did you see that. Now let's look at the questions from 8 to 14. We have questions and we have to answer in word or phrase. Question number 1. What should be used to elevate a patient's fractured leg? So here, there is a thing that is used. So what you will do, you'll highlight the keywords. Here we have fractured leg. I think it's going to be in the management part. Quickly go through that paragraph. Text B, with management part, you can see elevate the limb. So here you need something. You need a pillow. So pillow is the answer. Next one. What is the maximum dose? So here, remember, it's maximum dose of morphine per kilo of a patient's weight that can be used using intramuscular. So it's about dosage. Quickly go there. Here, text C. It's about the dosage of drug. You can see morphine, intramuscular. So maximum is what? 0.2 mg. So here you'll write 0.2 mg. Next one, from questions 15 to 20, you have to fill in the blanks. Let's see. Falling on an outstretched hand is a typical cause of what? Of the elbow. So I remember this was in text A. First, remember to highlight outstretched hand, typical cause. Here in text A, outstretched hand, elbow. So it's dislocation of the elbow. Answer is dislocation. Remember, you'll be writing the answers. You have to be careful about the spellings because here you're copying the word exactly from the text. And if you're still writing it wrong and you have spelling mistakes, you're going to lose the marks. Remember, part A is all about strategy and focus. In the first 1 minute, go through the text. In the second minute, go through questions 1 to 7 and do them quickly. Then you will have 13 minutes left with 13 questions left. So you can spend 1 minute on one question. But I recommend 40 seconds on one question so that you'll have some time left to review the answers. After completing the part A of reading subtest, you will have a break. Now let's look at the part B. In part B, you will have 6 questions. Each question has a paragraph. Each question and paragraph will tell you, what is this question about? Is it a manual? Is it a notice? Or is it a guideline? Here, what you have to do, first of all, read the question, what they're asking you about, and then read the passage. After reading the passage, go towards the options. You can see A, B, and C. You'll have 3 options and you have to choose the best one. Here, you can use some strategies. Number 1, try to eliminate the wrong one or the one that you think is not related. So for example, if I eliminate the first one, now I'm left with 2 options. And here it will be easier for me to choose the right one. There is a high possibility that the answer here is not exactly the same in the text. It's more like a paraphrased version of the answer. Let's see what they're asking you about. The manual informs us that blood pressure monitor. So something about that monitor. Let's read it quickly. With increased use of portable electronic devices, then it keeps going. Okay, so this may result in incorrect operation, create potentially unsafe situation. Okay, one thing, it's about medical devices, it is unsafe. If you keep going, you can see it's talking about medical devices. It's also talking about cell phones and other devices generating strong electrical electromagnetic fields. So here, now let's look at the options. Interfere with operation of medical equipment. Okay, this one makes sense. May not work correctly in close proximity to some other devices. Okay, this also makes sense. Should be considered safe to use in all hospital environments. I think this one is not even mentioned in the text. As I told you, you have to omit this option. Just filter. Okay, now you're left with A and B. It's talking about medical equipment, but here it's medical devices and cell phones as well. That's why B will be correct, because to some other devices may not work correctly. So B is correct. The same way, you have to complete all these questions. Read the question, read the passage, and then look at the options. Try to eliminate and try to understand what are they asking about and how it is paraphrased in the paragraph and in the options. Now let's look at the part C. In part C, you will have 2 articles. They will be around 800 words long. So here you can see a long article with the questions 7 to 14, and then one more text with questions 15 to 22. Each question will tell you where is the answer, so you don't have to get worried and find the answer in the whole article. You can see in question 7, it says in the first paragraph, so you can find this answer in the first paragraph. Then question 8, in the second paragraph. But sometimes they don't mention the paragraph number. Instead, they will use a keyword. For example, here we have Harvard Medical School. You can see in third paragraph, in the first sentence, it's Harvard Medical School. So it's most probably here. Sometimes they have underlined, highlighted, or bold text. It means you have to find this text in the passage and then find the answer. For example, that text is here. Here you will answer the same way. Read the question, go to the first paragraph, and then come back to the options and choose the best one. You will do the text too the same way. Remember, here you need a strategy because you have 60 minutes and you have to answer all these questions. In part A, you will not have control over the time because in part A, after 15 minutes, they will take away the questions or your answer sheet. Part B and C, you can make a plan. You have 45 minutes left. You have to do part B and C. In part B, you'll have 6 questions. In part C, you will have 2 texts. Here, you'll have 6 questions. Try to do them in 10 minutes. If you complete these questions in 10 minutes, you will have 35 minutes left. So now you can spend around 15 to 20 minutes for text 1, the long article, and then for 2. It's like 15 minutes here. If I give it 15 minutes and then check the answers, so in 45 minutes, you'll be able to do it. Remember, it's not about time. You don't need enough time, you need enough focus. Try to make a strategy, manage your time, and focus well. As you know, you'll have less time and you have to answer all the questions. Try to highlight the questions and remove the extra information. For example, types of dressing you have to avoid, on the wound, infected, and then quickly find the answer. When you will be completing the sentence, try to look at the words carefully. For example, involve, in patient's care, and answer is going to be a countable noun because involve, that's going to be a job title. And holes in the foot. It means you have to find this text paragraph about the foot. Here, when you look at a question, try to underline and highlight again. Okay, guidelines. It means it's going to be about the features and layout. Look at that. And the chemical waste disposal. This is the topic. Part C, when you look at the questions, try to paraphrase in your mind. For example, with a reference to social networking sites, a writer is illustrating something. So here, in other words, I will say, what is the writer trying to highlight when they mention social networking sites? It's more easier for you to find the answer in the paragraph. And one more thing. Recently, I got OET Gold Verified Badge, and I'm also OET Certified Official Course Teacher. If you have any questions, feel free to ask me. And if you're looking for one-on-one classes, contact me through email or reach me on my Instagram. Thank you and see you in the next video.